Good afternoon, everyone. My name is Charles Jason Domingo, and I am so sorry that I am unable to be in attendance physically with you all, with my group mates, Chelsea Grantham, Jenny White, and Catherine May Villalgo, on our amazing topic discussing daily weights as the seventh vital sign. Unfortunately, due to a work conflict, I am unable to get time off to be there physically with you all, but celebrating our graduation, graduating with our BSN at the end of this month. So congrats to all my SSU nursing students, as well as thank you to the faculty for this amazing opportunity to further our careers. So first things first, I really wanted to highlight the importance of obtaining vital signs and how daily weight is a contributing factor to that. So all of our group members are currently working in the acute care setting, working at the bedside, and have received doctor's orders as it pertains to obtaining daily weights. And oftentimes you can notice that discrepancy and inconsistency on weights being obtained. Sometimes they're not obtained at all, and sometimes if they are obtained, there's no streamlined methodology of what should be on the bed, right? Is it a fitted sheet? Is it a chucks? Is it a pillow? Is it a blanket? SCD machine. There is not a standardized way to obtain weights, and that was concerning for us. We wanted to collectively as a group identify a way that can be beneficial to obtain weights and also monitor for our patients who have congestive heart failure or even pneumonia. So our goal for this assignment and capstone project was really to survey the current nurses within the workforce and figure out what kind of barriers they endure to prevent them from obtaining accurate daily weights. And all of us did interviews prior to our project implementation to kind of just get a baseline as to how it was with obtaining daily weights for nurses. We know that the impact of the project, again, is to standardize daily bed weights and also to get an accurate collection of that. So as a group, we collectively wanted to implement our project on the unit. And what we did was we printed out cards to put on, little laminate cards to put on your nursing badge IDs to give you that kind of reminder, as well as on the vital sign machines, creating these laminates to place on there to remind staff nurses to obtain daily weights as the seventh vital sign. Some of the roadblocks, unfortunately, that we faced while implementing this project was staff being reluctant to removing some pertinent equipment, such as the SED or Isoflex machines, when zeroing out beds, just because of the process and the tediousness of taking it off and reapplying it. Also, just stressing the importance of adhering to the daily weight card. Sometimes nurses would just brush over it, as well as this essentially could have been discussed further in huddles, team huddles, to help kind of reinstate the quality measures of obtaining daily weights, especially since on the 4 West unit, we implemented this evidence-based project, and just having hospital staff buy-in as well as leadership to kind of kindly remind staff nurses to implement the daily weight of being the seventh vital sign. 22 out of the 50 staff nurses that work on the 4 West unit responded to the feedback via electronic survey, record their input, and we used a numeric scale, 5 being very beneficial, 1 being not beneficial at all. And what we found was that about 85% found the daily weight cards beneficial, the laminates that were placed on machines and staff ID cards, while about 15% of the nurses felt indifferent about it. They didn't think it was beneficial, but they also didn't think it was detrimental to their work. So they were kind of just, indifferent essentially about the project. As I conclude here, I really just wanted to emphasize the importance of quality patient care and making sure that we're always obtaining daily weights, not only as a measure to carry out as a doctor's order, but think about the patient that's at the bedside that may need these accurate recordings to ensure that the longevity of their life and positive health outcomes are promoted, as opposed to them unfortunately deteriorating and having negative health outcomes. If my group mates can attest to the importance of ensuring that you are really being there for the patient and carrying out these orders, and how important it is, especially for a patient with, for instance, congestive heart failure, how we need to monitor that they're not retaining any more fluid and their weight is trending down due to the diuretics or the restricted maintenance fluids that we're giving them as well. I conclude my presentation. Again, congratulations to all of the SSU nursing students, class of 2022. And thank you, SSU faculty, for giving us this opportunity to present to all of you and community partners. So thank you so much.